Hi, Mr. Teddy. Hope you're doing okay. So I actually see you're also here for a cardiovascular assessment as well. Okay. So this is just going to involve just general assessment of your heart, okay, and just around your chest area. So I'm going to be doing the same thing, similar things like we did at the back, where I have to, I'll be touching several parts of your chest and also listening to your heart with my stethoscope. Is that okay? Okay, good. Okay, so first of all, I'll be assessing for the jugular venous pressure, okay? First thing I'm going to do is have my patient sit in a 45-degree angle. I have my patient turn head to the left. And while I do that, I'm going to be looking for the internal jugular vein, okay? And this is located in the medial end of the clavicle, and just between the medial end of the clavicle and then the patient's earlobe, okay? And sometimes it's just under the medial aspect of the sternocleidomastoid muscle. Also, you can find it just above the clavicle, in between the clavicle head and the sternal head of the sternocleidomastoid muscle as well. Okay, so and then to identify the internal jugular vein, it is actually in a double waveform pulsation, so which makes it different from the external carotid pulse. So that's double waveform pulsation differentiates the internal jugular vein and the external carotid artery. Okay, so in order to measure the jugular venous pressure, so we're going to measure a vertical distance between the sternal angle and then the top point of pulsation of the internal jugular vein. So that'll be a vertical distance, between the sternal angle, and then we're going to look for the point of pulsation, the top of the pulsation point of the internal jugular vein. And that distance just between this and this, using my ruler to measure that. So that shouldn't be greater than 3 centimeters in a normal individual. Okay, all right. Okay, and then we're gonna assess for my patient's carotid pulses. So first, I'm just gonna tilt patient's head upwards. Just inspect for patient's windpipe. Just make sure it's symmetrical. I'm just gonna go two fingers just right into a hollow. Just put a little pressure, and I feel a thump. So when that thump is actually the carotid pulse, and I can do it the other way around, to the other side. The windpipe, and then two fingers right into the hollow, and then until I feel a thump, So, and it's not advisable to use our thumbs to palpate, so we have to use our 2 fingers, and we have to not palpate simultaneously, just to avoid cutting up circulation into the brain. Okay, next up we're going to assess for the brachial artery. So usually there are different ways which you can check for the brachial artery. Just right at the cubital fossa, just right above it, puts a little pressure on it, you can find the brachial artery. Just take about a finger, just a finger or 2 upwards, just above the cubital fossa. Just put a little pressure and then palpate. If you feel a thump, that is the brachial artery. Or just going just right across the biceps muscle. You just go right in the groove, apply some pressure, press up, and then you can also feel the brachial artery. And even if you don't feel it, you can just go out a little bit and put pressure and try to palpate. And once you feel that thump, it is the brachial artery pulse. Okay. All right. So we're going to also be inspecting and locating the point of maximum impulse. Okay. So the point of maximum impulse is actually located on the left side of the chest. Okay. So usually it is at the fifth intercostal space in the mid-clavicular line. So we're just going to look for the fifth intercostal space. Okay. Strangle my patient. Okay. So right here, this is where we feel this is where we have the point of maximum impulse, the fifth intercostal space in the mid-clavicular level. Okay. All right. So next we're going to palpate for trills and breaths. So just this actually indicates some kind of like murmur or like turbulence in the arteries. Okay, so trills are usually palpated, so we can use the carotid artery to check for a trill. So a trill feels like a cat's paw, when you feel it. Yeah, so just right at the carotid pulse. Yeah, so I don't feel it in this patient. Okay. And these are kind of like abnormalities too. And for breaths are usually auscultated. So we're gonna auscultate for a breath. Okay, just right at the carotid artery. Okay. So I don't hear any swooshing sounds or anything. So this is just regular pulses. I can feel just normal. Okay, perfect. All right. And then lastly, we're going to auscultate for heart sounds. So heart sounds are found in 5 different locations of the anterior chest. And that kind of indicates the location of the 5 different valves. So we have the aortic valve, which is in the second intercostal space, pulmonic valve, and also in the second intercostal space of the left side of the chest. And then we go all the way down to the third intercostal space where we find the Ebbs point. Okay, and then from there we go to the fourth intercostal space and we find the tricuspid valve. And from the fourth intercostal space, we go all the way down to the fifth, all the way around the mid-clavicular line. That's where we find the mitral valve, and we auscultate that. Okay, so I'm gonna use my stethoscope to auscultate for patient heart sound. Make sure there are no murmurs or abnormal sounds. Okay, it's just gonna be the regular lopped up S1, S2 sounds. Okay. The aortic valve area, pulmonic valve, the Ebbs point, tricuspid valve, and then also the mitral valve. And in this patient, I do not hear any abnormal heart sounds, just regular S1, S2 sounds in all 5 points. And this comes to the end of my cardiovascular assessment. Thank you and have a wonderful day. And thank you for your service, Mr. Teddy. I hope you feel better.